We're talking about plastic surgery with renowned top Chicago plastic surgeon Dr. Anthony Geroulis and his patient Sandy Hanrahan, who is 65 years old and young, I should say, 65 years young,
Yes.
and looks incredible. We're going to get to your results in a second, Sandy, because we're going to have a before and after. But we really need to talk about the Chicago look. It is so different than what women are doing in LA and what women are doing in New Jersey. And we have some examples from the Real Housewives of LA and Beverly Hills, if you've seen it. You know, some of these women have that overly done look. Their lips are big, you know, their cheeks are plumped up. And Dr. Geroulis, when you see these types of shows, what is it they're doing?
Well, it's a question of patient preference. So if the patient comes in and they really want large lips, then oftentimes the surgeon will go ahead and accommodate them. However, it just depends also on the philosophy of the surgeons involved and the preferences of the patients. In the Midwest, it's a more conservative environment here. And as a result of that conservative environment, the ladies come in, and the men, by the way, 35% of the patients I do are men.
Wow.
But they want a refreshed look. But they definitely want a natural look. They want to look like themselves, but a few years ago.
And you know, it's interesting, that kind of comes full circle. We were talking about 40% of women in America now the breadwinners. You said you do hear that from your patients. They want to look younger for job reasons and being out in the workforce.
Right, they want to look fresher. They don't want to look tired. They want to still look like themselves, but they want to look refreshed.
All right, let's talk about some of the things you can do, because all of us sitting on the couch here were just wowed when we met Sandy. You look great, 65 years young. Let's see the before and after pictures here, because this is truly, it looks wonderful. Sorry, those are the Real Housewives of New Jersey. Sandy does not look like
Sandy. That is not Sandy.
We're going to try to get the before picture here up, but Sandy, as we effort that, let's talk about you and why you decided to do this. You said you really hadn't touched your body, your face before.
No, I hadn't. I just was finding myself feeling like I looked so old, and I was isolating myself and not seeing family and friends like I used to, not allowing myself to be photographed. And I finally decided I was going to do something about it. I'm, you know, a savvy consumer. I'm a nurse, a former nurse. I'm retired now, but worked 40 years, and I did my due diligence and got 3 consultations. And one of my physician friends recommended that I see Dr. Geroulis. I wasn't pleased with the first 2, and there were some criteria I had. I mean, I was really concerned about postoperative infections. I didn't want to go into a hospital setting. I wanted to go somewhere where they had a surgery center.
Talk about the look you wanted to achieve.
The look is absolutely what I have now. I'm a little less than 5 weeks post-op, and I had my eyes and my chin done. When you see the before, you'll see the difference.
They showed it, and
it's
it is
dramatic.
incredible.
It's very
Here it is
dramatic.
again.
Yeah.
Let's take a look at the before.
It's pretty
And
dramatic.
but you said it was important to you. You really wanted to look like you.
I wanted to look like me. I didn't want to look like somebody else. I didn't want to be tight. I wanted to look natural. I wanted to look refreshed. I wanted to feel like I did maybe 20 years ago, and I think it's pretty much been achieved.
You look incredible.
Unbelievable.
So what did you have done?
Well, I had my eyes, upper and lower eyelids, and the low, I mean, you can't even tell, like there's nothing left. It's not even 5 weeks and I have no scarring. I had liposuction facelift, so all that girth was removed out of the liposuction, all the fat, and then the face lifted. And I feel like 2 weeks after surgery, I was out and about.
You know, you seem so open about it, and do you feel that there's still a stigma here in
Right.
Chicago when you tell friends and family members, I'm going to go get plastic surgery, I'm going to go get my whole face done?
Well, I really didn't tell too many people at first, so I've told a few more people now, but I wanted to wait until I saw what the results were. I wanted to be able to, you know, say, look what this man did for me. I mean, because people that know me, no, it's like a miracle to see the difference. And I'm myself again. I'm happy.
You feel good.
I'm outgoing. My husband loves the way I am because I want to go out all the time now.
Right.
That's
Dr. Geroulis, tell us
fantastic.
about some of the things you can do that give you that refreshed look, but still looks natural.
Well, it depends on what the patient presents with. But in younger patients, meaning 30, 35, 40, oftentimes it's the eyes. They will present with bags under their eyes or excess skin, a little fat sometimes protruding in the middle part of the eye.
Why do you keep looking at me when you say
No,
that?
Because you're beautiful.
No, I'm leaning back. Like, don't look at my face too close. They'll be like, here's a free card for a consult, free consult.
Can I have an appointment tomorrow?
But in any event, and so then you'll evaluate the patient. It's a patient preference driven area. You ask the patient, or I ask the patient, what is your concerns with your face? Now, oftentimes the patients will say, well, you tell me what you think, in which case then I will evaluate their face and give them some suggestions on what we can do to refresh them, to have them look like themselves always, but a bit younger, themselves years ago.
So there are things other than
great idea.
Botox, and if people don't want to get a full surgery or get their
Right.
face totally redone, what are the couple of other things you might want to look into if this is something that is something you like?
Well, there you see now being active in the medical industry, sort of the battle between the knife and the needle.
The needle.
That's right.
It's as simple as that. Obviously, surgery will give you a longer lasting and a more definitive result if done properly and for the right areas of the body or face. The needle will be dependent upon, like surgery, the person injecting, their years of experience, their knowledge of the anatomy, and so forth. Now, if they inject too much, then you get this overemphasis of the lips or the puffiness of the face.
We've seen that. Actually, we
Yes.
have a shot of some celebrities too. We've seen Madonna and Amanda Bynes often get criticized for that look, of that over puffiness look that
Right.
may be what you're describing.
And so there, I believe, in the Midwest, I see in Chicago a more conservative approach in terms of treating the patient.
All right.
I will give them an injection and then see them back, and if they need another one, we'll consider it.
All
That's
right,
awesome.
Dr. Anthony Geroulis gets people thinking of maybe this is right for them. We appreciate you discussing it with us.
Thank you.
Sandy, you look amazing.
Thank
Thanks
you.
for
Thank
sharing
you so much.
your story
I'm
here
honored to sit with
with
you,
us.
beautiful women.